Hi, my name is Laura, and today I'm going to be demonstrating how to change a sterile wound dressing and how to get a culture while we do that. And I will be demonstrating that while practicing my GPSP. So first what we're going to do is we're going to practice our hand hygiene. So we're going to check the patient's medical record, and we're going to see what kind of a wound care we're going to give the patient according to their orders or their nursing plan. And while we're in there, we're also going to see if the patient is on any kind of analgesics, whether it be over the counter or any kind of prescription medication. So we've already done our hand hygiene. So we're going to go into the patient's room and we're going to identify our patient. So, can you tell me your name and your date of birth? We're going to check the patient's ID bracelet and confirm that they are the person and the date of birth. And do you have any allergies? Okay, and do you have any pain around the wound? And if they have any pain around the wound, this is when we would give them their analgesic. And we would give that analgesic a little bit of time to kick in, and we would come back and finish out the wound dressing. But our patient today is saying no, they are not having any pain. So we are going to go ahead and change his dressing. So at this point, I am going to put on my gloves. These are just your regular clean gloves. Okay. And what I want to do is I want to make sure that the patient's bed is at a comfortable working level. And since this is a sterile procedure, I'm going to want to make sure that this is at elbow height for me, which is pretty high. So I have went ahead and I have already lifted the bed to elbow level. So I'm going to bring down his covers because this specific patient has a lower abdomen wound. Now, as I bring down his covers, I'm going to be mindful that under the wound, it's not going to be bulky with the covers so that I do not cross-contaminate the sterilization when it comes time for that time. Now, during the exposure, I am most certainly going to maintain his privacy because it is in a sensitive area. Okay. Okay, now first what I'm going to do is I'm going to put a Chuck's pad under him. In some wounds, you might have to irrigate the wound, and that could cause a messy situation. And it would protect the patient, protect the bed. So just going to unfold this. And I'm going to gently slide it under my patient, like so. Okay. I'm going to grab the biohazard bag. And I am going to place the biohazard bag in a convenient location, which is usually on the bed, and I'm certainly going to ask the patient if it's okay if I put it on his bed. And my patient said yes. So I'll put it right there. Now, next what I'm going to do is, if my patient had any kind of drains or tubes or colostomy, anything like that, IV, just anything of that sort, I'm going to make sure that they're out of the way. Okay? So next we are going to take the bandage off. Now when you take the bandage off and you pull the tape, you want to pull the tape in the direction of the hair growth. And also you want to pull the tape by using the push-pull method. Okay, so you pull the tape and you push the skin away. So that's what we're going to do. So push, pull all the way around. And if you're having trouble getting that bandage off the wound because there's a little bit of stickiness from the wound to the bandage itself, you can actually get a little bit of saline and pour it over the bandage or over the area itself, and it will soak it up and it will actually unstick. And that's a nice, safe way, because you don't want to rip it off and cause pain and more damage to the wound itself. So we've already taken off our tape, and what we're going to do is we're going to grab the bandage from the center and we're going to look at the bandage. We are going to inspect the bandage, we're going to inspect the drainage, we're going to see the type of drainage, we're going to assess basically, and we're going to look at the color, we're going to check the odor of it, we're going to check the amount. Okay, and then once we've done all that, we're going to throw this away. And that goes right into our biohazard bag. Now, we take off our clean gloves. And we perform hand hygiene. Gloves off, sanitizer on. Good rule of thumb. Now, bandage is off and we have our wound. Now what we want to do is we want to inspect this wound. Okay? What do the sutures look like if there's sutures? What do the staples look like if there's staples? Is there any swelling? Is there any redness? Just take a look at it and assess the wound. Now, at this point, this is when sterility begins. Okay? So, what we must do is we need to set up a sterile field. So, I have my supplies, which this is a pre-packaged sterile container, and it has all my sterile supplies in it. So everything inside this container is sterile. Everything on the outside is not sterile. And this table right here is already clean and sanitized. So what we're going to do is we're going to open my container and we're going to just get that out of the way. Okay. I'll take my gloves and I'll put them over on the side. Now, the next item we're going to take out is our sterile field. Now I'm going to lay that flat, and I'm only going to grab it on the corner, which is 1/4 of an inch on the corner. Okay. I'm going to hold it up and not let it touch anything else. Now, this sterile field is sterile except for 1 inch around the sterile field. That is considered unsterile. Now, anything hanging off of the table is considered unsterile plus 1 inch into the sterile field that's on the table. So that's something that needs to be remembered. Now we're also going to do a culture. So here I have my culture. So inside of my culture it is sterile. So we're going to open the package, and without me going over the sterile field, I'm going to drop it above 6 inches. And it remains sterile. And I'm just going to put that in the trash in my biohazard bag. Now, the next thing that I need to do is I need to put on my sterile gloves. And that can be a little tricky, so we'll see how it goes. First, we're going to open it very carefully. On the outside, it's not sterile. On the inside of the sterile glove package, it is sterile, except for 1 inch around the border, just like our sterile field. And we will unfold, grab the flaps, and open. Now, I am right-handed, so with my non-dominant hand, I am going to grab the cuff of the glove, and I'm going to put my dominant hand inside of the glove as I stepped back so I don't touch anything sterile. And as my glove remains cuffed, I am going to work that down my wrist just a little bit. And my glove is still cuffed. Now I'm going to go for my glove on my non-dominant hand. Now I am going to take fingers 2 through 4 and I'm going to place them on the inside of the cuff. Working them down inside the cuff. The non-dominant hand, I'm going to place them inside the cuff. And if it rolls, it's considered unsterile. You gotta get a new pair of gloves. But it's not rolling, and I'm doing really good. All right, so I'll go back to my, and I have successfully put on my sterile gloves. Now, we are going to cherry pick our sterile items out of our sterile container. So, standing away from the table and keeping our elbows to our waist. Move that table with my foot. Okay, now as I was placing my items onto the sterile field, I can only go over the sterile field as far as the glove cuff could allow me to. My bare skin could not go over the edge of my sterile field. That's something to remember. Now, it is time to clean the wound. So what we're going to do is, remember, I can never turn my back on the sterile field or on the patient once I have sterilized the wound. So what I'm going to do today is, we have some some non-antimicrobacterial swabs to clean this wound with. So these are pre-packaged, and I am going to take the top of the package off and throw it away in my biohazard bag. I'm going to take a swab, and since this is a abdominal wound, it's not round, it's longitudinal, I am going to clean the wound from top to bottom. I'm going to start from the dirtiest to the cleanest, and I am going to start down the middle first. So first I'm going to clean top to bottom, throw it away, and I get a new one. I don't recycle that. Now, the middle of that wound is sterile, so I'm going to have to go around where I just wiped, but not to cross-contaminate, not to touch the covers, okay? So I am going to have to clean the outer away from me. So I go top to bottom, farthest from me, throw away. Now I take a new one and I wipe top to bottom, closest to me, throw away, throw away. Then I grab my tweezers and I take the gauze and I kind of make a little dumpling, and I dry it. So pat, 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 in a patting motion, okay? You want to pat dry it from top to bottom, okay? And once you use it, you throw it away. So pat dry top to bottom, throw away. Pat dry top to bottom, throw away. Throw away your tongs. So now we have a wound that is sterile and dry. So this is the perfect time to get the culture. So we get our culture, and what you want to do is you want to put it in the wound in a 1 centimeter area, and you roll the swab, and you want to push in a little bit to get some of that drainage on there. So you put it in the wound within 1 centimeter, get some of that drainage by pushing in. Okay, now we got our culture. And when you put it back in your tube, you want to be very careful, and you don't want to touch the sides because that can contaminate it. Now this doesn't have to go back on your sterile field. This can be put anywhere, okay? So we can just put it over here on another table. So now we have our culture. So next, what we're going to do is we're going to cover that wound. So and we don't have to be sterile any longer, but these are still clean gloves, so there's no sense in taking them off. So we're just gonna stay clean. Now, I have a new dressing put on him. Now, if he would have had in his medical record that he needed some kind of an ointment put on there, I would have put that ointment on there right before I put that dressing on there. But he didn't have anything like that in his medical record, so we don't have to do that. So now I'm going to get the tape, and I am going to tape the dressing onto him. Well, I can't find the, oh, here, I think I got it now. Ah, eureka, I got the tape. All right, now we are going to tape all four corners of this dressing. Okay. And now our patient has a clean dressing on his wound. So what we can do now is we just clean up our work area. So we take the chucks out. And like I said, we're not sterile anymore. So we just clean up our area. Take off our gloves. Oh, whoopsie. Perform hand hygiene. Oh, but we're not done yet. Next, what we're going to do is we are going to put initials, date, and time on a piece of tape, and we're going to put that right on top of his dressing. Okay, because we don't want to leave a dressing on there for 2 weeks. That's no good. And we're also going to grab the culture, and we're going to put initials, date, time, and also the location of the wound on this culture, and we're going to send it off to the lab. And something that I forgot to say, I did forget to say one thing, is whenever we get that culture, we do not want to put that swab around any of the necrotic skin. We want to put that right in the middle of that wound. Okay, so we don't want to touch that around necrotic skin. So we're just going to grab our bag, and we're going to dispose of that elsewhere. And we are going to make sure the patient is nice and comfortable. We are going to reposition our patient if he needs repositioned. Just whatever he wants to do to make him repositioned and happy and comfortable. And we are going to lower the bed back down. And if he needs anything, I'll go fetch it for him. But thanks for watching, because that's how you change a sterile dressing with a wound culture. Have a great day.